Go.
Good morning, Rhonda. How are you today?
Good morning, Kelsey. I'm doing well.
Great. Are you ready to do Mrs. Lincoln's bedside report?
Yes, I'm so glad we have changed this bedside report.
I am too. At first I wasn't sure about it. I thought it'd take too much time and it would really be a pain.
I know, I thought the same thing as well, but now that I've gotten used to it, it is actually faster.
It allows us to see our patients first thing at the beginning of the shift and allows us to better prioritize our patients' needs. And it allows the patient and their family to get involved with their care.
I feel like it allows the patients and their families to be more comfortable asking questions, have a better sense of what is going on.
I agree. If patients are hesitant to ask questions, it could threaten their safety and quality of care, especially if it involves needing help to get out of bed or if they're in pain.
Good morning, Mrs. Lincoln. How are you doing this morning?
Oh, okay.
Well, I'm getting ready to leave, but Kelsey here is going to be your nurse today.
Good morning, Mrs. Lincoln. I'm going to be taking care of you today.
Good morning.
We're going to do our shift report at the bedside this morning, and Mrs. Lincoln has already given permission for our daughter Natalie to receive information on her care. All right, Kelsey, I'll give you Mrs. Lincoln's history, and Natalie or Mrs. Lincoln, if you have any questions or comments, just let Kelsey know throughout the day or the report. All right, in room 2, we have Mrs. Lincoln, a 66-year-old female who is 1 day post-op of a total knee arthroplasty. Her doctor is Dr. Moneybags. She has a history of osteoarthritis. Her surgical incision looks very good with minimal redness and edema. Mrs. Lincoln, can we do a quick skin assessment and check your surgical site?
I guess that'd be okay.
Okay, put some gloves on. Okay, I'm just going to look at your elbows. Okay, everything looks good.
All right, her blood pressure this morning was 118/84. Your temperature was 98.6 and pulse was 72 with respirations of 17. Her oxygen saturations were 99% on room air. Mrs. Lincoln is alert and oriented ×3. Her last bowel movement was on May 7th, the day before her surgery. All her bowel sounds were present. She is up with the assistance of 2 and a walker. There is a bag of D5.5 normal saline running at 100 milliliters an hour.
Okay, I'm just going to check out your IV site. That looks good. Any pain with that?
No.
Okay. All right, that all looks good.
All right. She was given an oxycodone at 5 this morning, and she can have another one this morning at 9 if she needs it. She is taking Colace twice a day for constipation. She will receive an enoxaparin injection this morning with her 9 o'clock meds. There's an order for Zofran for nausea and vomiting as needed, and an order for Tylenol as needed for fever and over 101.5 and headaches. Her H&H were a little low this morning. Other than that, all her labs were normal.
Okay.
Oh, what's an H&H?
Oh, it stands for hemoglobin and hematocrit. Hemoglobin is an oxygen-carrying part of the red blood cell, and it's responsible for getting the oxygen to the tissue, and hematocrit is the percentage of the blood that is red blood cells. It's not uncommon for these values to be a little on the low side during surgery due to blood loss during the procedure.
Oh, okay. So sometimes those values can be, it's normal for it to be abnormal.
Yes, it's common.
Her lungs this morning were clear upon oscillation, and are there any other questions or concerns?
Could you raise my bed up a little bit?
Yeah, I sure can. How's that?
That's better, thank you.
Is there anything else I can get for you?
No, I don't think so.
Okay, well here's your call line, and if you have any questions or need anything, just call me, okay?
Okay.
Thank you.
Okay.